We're joined now by a key member of the Trump administration, Secretary Ben Carson, a member of the coronavirus task force and head of the Department of Housing and Urban Development, also known as HUD. And he is also a medical doctor. Thanks so much for your time.
Pleasure.
Secretary Carson, the coronavirus has created a troubling racial divide, as you know. And while we don't have national data on deaths by race, we do know that in Chicago, for example, blacks are 3 times more likely to die from the virus than whites. In New York City, blacks and Latinos are 2 times more likely to die. Is the administration doing enough to address this disparity?
Well, you know, this crisis has really shined the light on this disparity issue. But you have to look at the layer beneath. Why is it that in Hispanic and African-American communities, you have higher incidence of that? And I think, you know, you have to look at the housing situation, the crowding, the inability to have appropriate distancing. You have to look at the nutritional issues, which tend to be really substantial, the medical issues in terms of appropriate follow-up, transportation, child care. There's a whole host of things that have to be fixed. You have to approach it in a holistic manner.
And how do you do that? I mean, for example, just today, New York governors mentioned exactly what you're saying that the new coronavirus hospitalizations and deaths mostly originate in minority and low-income neighborhoods. He raised that specific issue of how public housing residents are expected to socially distance in a tight space. So how is your department addressing this issue, and are there any solutions?
Yes, there are solutions. And this is probably our chance to really take care of it, because through the CARES Act, a significant amount of money has been allocated. So working between federal, state, and local agencies, we will be able to do this. We'll be able to use federal lands, for instance, to do some building and take advantage of some of the tremendous innovation and entrepreneurial spirit that exists in this country. It means we have to do something about the regulations. I've been talking to a lot of governors and mayors and various officials around the country about those barriers that prevent us from building affordable housing. We're going to be able to get that done. We're looking at new ways to utilize the federal housing funding with mobile vouchers so that people have more choices so that they can move around.
President Trump has, of course, directed a White House council to address economic disparities in African-American communities. Senator Tim Scott is heading that up, and the senator has said that he and your staff have been trading ideas for an upcoming presentation. Any basic ideas that you can share with us as far as possibilities of at least what you might be exploring?
Well, for one thing, you know, we want to have a national urban renewal program, and we really want to concentrate on the nonprofits. You know, we're looking at the public housing tenant empowerment demonstration, and then thinking about things like how we've changed because people have learned about teleworking. And I don't think you will ever have the same number of people jamming these offices around the country. That's going to change. Because
you are a medical doctor, I'd be interested to get your opinion weighing in on President Trump, of course, saying this week that he's taking the malaria drug hydroxychloroquine as a preventative measure against COVID-19, despite the drug's potential dangers. He even suggested that there's nothing to lose. Do you agree with the president on that? And also, do you think that he should wear a mask, which is something that experts agree would be helpful?
Well, remember that you know, hydrochloroquine's been used for 60 years for malaria. More recently, it's been used for lupus and autoinflammatory conditions and has a very long safety record. But it has to be used in conjunction with a healthcare provider who can determine whether you have any contraindications for the use of the medications.
So you think it's a good idea?
I think if you're at risk of transmission, like medical workers and people who come in contact with a lot of people, it is not a bad idea if your physician feels that way, knowing your medical history. That's a very important part of it. You can't just do it.
And what about wearing a mask? Is that something that you wear? And also, is it something that you think that the president should?
I wear it when I cannot appropriately social distance. And I think everybody should do that.
All right, Dr. Carson, thank you. Glad to have you on the show.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.